we should get started. And I know we'll have some people joining, but we'll do some front matter first. So hello everyone on the call and the video. I'm Brett Hammond, one of the trustees at EBRI, and I am really delighted to have been asked to host and moderate this meeting. I'm excited for the work that's been going on in EBRI, and we're going to do kind of a lightning round through two overall topics, retirement-related issues and health. And I'm just very excited to hear the news from latest research findings from EBRI. A little bit of housekeeping before we get started. You want to go, if we can go to the next slide. So the first thing is, well, you can see a picture of me, but the more important issue is that you can see that our two presenters today, Zara Ibrahimi, who will be talking to us about three retirement-related topics, including some of the news on effects of COVID-19 on the retirement system, as well as retirement confidence survey, and then Jake Spiegel, who's going to do count them five health topics plus future research. And so we're all looking forward to that, and I'm not going to waste time by telling you all five topics. So if we can go to the next slide. So this is the real housekeeping. We're very happy to have you ask questions. You are going to be on mute. Only our panelists will be speaking today, but you can use the chat button that you find at the middle bottom of your screen to send us questions, and the panelists will be able to see them. And we will hold your questions till the end, but we will try and get to as many as we can at the end. And then I have some backups in case because there's some interesting things I've found in this too. So again, chat buttons at the middle bottom. Please feel free to use it as we go along, and they will be saved up for answer at the end. We'll get to as many as we can. Next slide, please. So we'll do a little bit of when we get to the end. I'll also do a little bit of upcoming events from EBRI, as well as some other things. So stay tuned through the hour. We'll try and we'll end on time. And but without further ado, Zara is going to start us through the three topics that you see on your screen, and I'm really looking forward to this because some of this is just hot off the press, and some of it is very fundamental stuff on debt. So Zara, why don't you get us started today? Thank you very much.
Thank you very much, Brett, for the great introduction. So welcome to everyone. As Brett mentioned, I will cover some of the recent researchers on the retirement here in the EBRI. So the first topic is directly related to the current market crisis, and the second one has implications about the effects of pandemic. And the last one doesn't have direct implication for the current situation, but it will help. It would alert us basically on households' situation on top of having the economic difficulties that are happening right now to the older Americans. So I will start first with the first topic that covers the preliminary analysis on the impact of 2020 market crisis on retirement income adequacy. Next slide, please. Next one. Okay, so this research, as I mentioned, explores the aggregate or the macro level potential impact of the 2020 market crisis due to the pandemic, as well as also some assumptions on employer and employee behavioral changes in terms of contribution, and also plan termination basically and withdrawal from the plans. So we are going to see that what will be the individual impact of any of these factors, and also we are going to see the combined effects of these factors. So here, the first is just to set the scene for you. This research has been done by EBRI's retirement security projection model. This model is basically used here in EBRI to simulate the percentage of the US population who are at the risk of falling short of their retirement income what they basically need to cover their expenses. So that this model basically helps us to project how many people are gonna have are gonna be short of income to cover their expenses, basically. And it accounts for the deterministic expenses that people are going to have, and also the stochastic expenses like health expenses that and long-term health expenses that they are going to have in their retirement years, basically. So before all these, before the pandemic, RSPM projects that there is going to be $3.68 trillion aggregate deficit at macro level for all US household ages 35 to 64 as of January 1st, 2020. So even before the pandemic, this shows that we have how much shortness of sources are there basically in the economy. And in the next few slides, you're going to see that what's going to happen into this base as we measure the impact of different components that is caused by the current crisis. Next slide, please. So first slide focuses on market volatility. So it shows that basically we have three scenarios. So it assumes that the first one, the optimistic assumption assumes that the market condition stays half of what it was at April 1st, 2020. So basically we take the market conditions at the first quarter or the first day on April 1st, 2020, and we'll assume that market will recover half of that to half of that, and then will stay the same in the optimistic scenario. In the intermediate one, we will assume that it doesn't recover. It will stay the same, whatever that was on April 1st, 2020. And in the pessimistic scenario, we will assume that market losses will be equivalent to what happened in 2007-2009 crisis, basically. And here we assume that there is no behavioral changes. So basically nothing happens to employer contribution in terms of contribution withdrawal behaviors and plan termination. We're going to see that in the next slide. So, and these figures are showing the impact of each of these scenarios basically on the retirement saving shortfalls. So what happens on top of what we already saw, how much they're going to increase that number. What we see here is that in the case of intermediate assumption, retirement deficit will increase by 3.7%. In the optimistic case, RSPM projects that retirement deficit will increase by 2.3%. And obviously for the pessimistic, we have the worst increase, and we will have 9% additional deficit on top of what we already had. Next slide, please. And from here, as I mentioned in the previous slide, we ignored what was happening in the behavioral employee behavioral changes. So in this set of assumptions, we will take the intermediate assumption from the previous slide. So we will assume that market conditions will remain the same as of April 1st, 2020. But on top of that, we will look at various assumptions about employee behavior with regard to some plan termination, suspension in terms of contribution, withdrawals. And you'll see that, and the numbers again will show that how much more basically we'll have a retirement deficit. And it's, as you can see, the third scenario, which is the small plan termination, will have the largest impacts. But overall, we will see that the impact of these behavioral changes are not as large as what we saw in market volatility case. Next slide, please. So here, what we see that now we know that none of these scenarios will happen in isolation. We are going to have a combination of two. So here we are trying to see what happens if we combine these two. So again, we have three scenarios. We will have the intermediate market volatility assumption combined with intermediate set of assumptions of what we saw in behavioral changes. And in the optimistic, we will have optimistic, basically market volatility scenario plus the optimistic assumptions about behavioral changes. And in the pessimistic, we have the combination of all pessimistic assumptions. And as you see, and as expected, the pessimistic one is the one that will cause the largest deficit, basically. Compared to the other two, the pessimistic one is projected to cause $412 billion more deficit, or basically 11.2% more deficit in the retirement system. But it may seem that this number, this 11%, seems it's not that large. It seems manageable, but this shouldn't mean that this shouldn't basically minimize the potential impact of the current situation on the specific individual. This is the number that has been created on at the macro level. But if we focus on specific groups, those who have lost, for example, their jobs, and more specifically look for different demographics, different income and wealth groups, we will most likely see more damage at individual level than aggregate level. And that's why in future EBRI research will focus basically on this topic. So stay tuned for that one. So with that, I will finish this topic and we can move to the next one. Next slide, please. So in this topic, we will look at the results of retirement confidence survey with a specific interest on before and after the pandemic, which I'm going to explain in a minute. So to give you just some introduction on what is RCS, or Retirement Confidence Survey, this survey is the longest running survey of its kind that measures workers and retirees' confidence about retirement, and it's conducted. It's a collaboration between Employee Benefit Research Institute and also Greenwald and Associates. So this year's RCS was conducted between January 6th and January 2020, and the number of people who were in the survey were a little over 2,000, and it was a split half and half between workers and retirees. And that, as a timing suggests that when this survey was done in January 2020, it was right before the pandemic. And because of all the changes that happened after the pandemic, researchers who were conducting the RCS decided to do a supplemental survey in March 2020. And they had, it was conducted in between March 20 and 30. It had a subsample, about half sample size of the original sample. It was 1,000, and it was split half between employer, employee. So in the next few slides, we are going to basically see the results that were conducted from the original RCS, and we'll compare them to the previous years, but also we are able to compare the results from the March 2020 and January 2020, just a few months into the pandemic, and see if it had changed workers and retirees' confidence with regard to retirement into the pandemic. Basically, we are going to see that if this has changed. So next slide, please. So what we see in the first slide is that the first set of questions are focuses on both workers and retirees' confidence in financial security throughout the retirement. More specifically, question asks, overall, how confident are you that you and your spouse will have enough money to live comfortably throughout your retirement years? So here we see that the percentage of workers and retirees that answers very confident or very somewhat confident. We will see these answers. We will see that among workers, 69% are confident, they will have enough to live comfortably, including 27% who are very confident, and which is up than the number that it was in 2019 and also in 2018. Overall, we see that retirees remain more confident than workers. The numbers are higher. And also in 2020, you'll see that the confidence in having enough money to live comfortably throughout retirement has been declined significantly from the numbers that we had in 2019. And also we see that among both workers and retirees, overall confidence in being able to live comfortably throughout the retirement did not significantly change between January and March. So we don't see the effect of the pandemic in this set of questions for both workers and retirees. Next slide, please. This next set of questions focuses on worker confidence in other aspects related to retirement. In this slide, we look at the findings from this set of questions for workers, and then in the next one, we will look at the responses from the retirees. So the first question asks about workers' confidence in being able to take care of basic needs in retirement. And in this set of questions, we will see actually the real impact of the basically a statistical significant effect of the pandemic. So the first, as I mentioned, the first question is about confidence in being able to take care of basic needs in retirement. And we see that even though a percentage of those responded very confident was 33% in January, which was higher than the last year, in March, that number dropped to 24%. So less people in workers are basically confident now, just 2 months into the pandemic, that they are going to be able to cover their basic needs in retirement. Second question asks how confident you are that you have enough money to take care of your medical expenditures in your retirement. And the share of workers who are very or somewhat confident increased from 59% in 2019 to 64% in 2020. Again, you will see that when the same question asked in March 2020, this percentage, the percentage of people who were very confident significantly decreased. And the third question asks, do you have enough money to last your entire life? We see a similar pattern. We see that the overall confidence went up at the beginning of 2020 compared to 2019, but in March we'll see that it has gone down basically compared to January. Next slide, please. So in this slide, retirees respond to the same set of questions. And what happened here is that the retirees, we see that 81% of retirees feel confident they will have enough money to take care of their basic need in retirement. And they have enough to take care of their medical bills. And these numbers, we see that have enough to take care of their expenses. It was 70% in 2020. It was down from 80% in 2019, and they have enough money to last their entire life. It was 68% versus 76% in 2019. And also, we see that the retiree confidence did not see significant changes between January and March. So overall, we don't see the impact of the pandemic when the same set of questions are asked from the retirees. Even though we saw them for the workers, we don't see the impact in the retirees in this survey. Next slide, please. So the next slide asks workers' confidence in doing a good job in preparing for the retirement. And what we observe here is that in January 2020, 67% of the workers report they are confident and they are doing a good job preparing. In fact, share of those who are very confident has increased from 21% in 2019 to 25% in 2020. And again, here we don't see any significant changes due to the pandemic. Again, this is just a few months into the pandemic, January and March. Next slide, please. And here in this set of questions, we're asking, their questions are asked from the workers about their employment, basically. And the question asks, first question asks about what has already happened to them. It asks them, has the employment status changed for them starting February 1st, 2020? And this, the next question asks them, how do they anticipate to anything happen to their employment status in the next 6 months? And here we're seeing the results. So in the first one, when it asks, has anything happened to them, 68% answer no, and 11% answer that it has impacted them, their employment status, in a negative way. And again, just consider that this is just a few months into the pandemic. It was the difference between January and March. And when asked about how do they anticipate their employment status change in the next 6 months, only 55% expect no change. And you will see that basically nearly half of the workers anticipate that their employment status change in the next 6 months, and 12% of them predict that it's going to impact them in a negative way. And these are important because in the next slide, please, we see that basically we ask those people who either their employment status has changed in a negative way, or they anticipate it's going to change in a negative way. We will ask a set of questions from them. And here you can see the results. And the results show that basically the confidence is significantly lower among those who say that their employment status is negatively changed or is going to change. You'll see that those numbers are much lower for those who have been affected negatively, basically. So a few things just to summarize this research is that even though the March survey was just conducted a few months, like 1 or 2 months into the pandemic, it still captures the lost confidence among workers, and more specifically among those whose employment has been affected negatively or is going to be affected negatively. And we are hoping that, or we are expecting that the future waves of this survey will reveal the full impact of the pandemic for the retiree confidence, basically. Next slide, please. So,
and I'm sorry, Sarah, I'm going to break in and say, speaking of confidence surveys, I am confident that you can get this last bit done in 7 minutes. Thank you.
Sure. Thank you. So the last topic will focus on the basically household debt among older Americans using HRS dataset. So just to give you, again, a summary of the dataset, HRS dataset is a representative sample of the older population here in the US. It is started in 1992, and it surveys people with representative, financial representative of 50 years old, 50 or older. And it will ask different questions with respect to income, financial, basically, status of the household, and also demographics. And it's a very extensive survey, and it repeats every 2 years. So it re-interviews people every 2 years, and every 6 years a new wave is added to the sample. And here we're using this survey to study how household debt among older Americans has changed over the years. Next slide, please. So we will primarily, I'm just showing you some of the results from this research, and we will focus on 3 age groups, those who are between 50 and 64, those who are between 65 and 74, and those who are 75 and plus. And we use the surveys between 1992 and 2016. And here we will see the results for the first age group. As you can see, that the red line shows the share of people or the likelihood of being in debt, and the bar charts are showing the average and also the median total debt among households in this age group. As you can see, that the likelihood has not changed much, but the average and also median total debt has increased sharply between 1992 and 2016 for these households. The next slide, please. So the second age group, we'll see that not just the total and average, but also the likelihood of being in debt has sharply increased between 1998 and 2016, which is the years that we can observe this age group. And so for the first two age group, we see that the situation has gone worse, not just the likelihood, but also the average and median has increased. The next one, the next slide, please. And for the 75 and older age group, we don't see much of a change, at least for the few years that we were able to observe them. We see a little bit of change in the median in 2014 and 16, but for the most part, the likelihood and the average stays the same. So the main message from these three is that we see that the likelihood for the at least pre-retirement age groups and also early retirement age groups has increased, and also the average and median total debt has increased. The next one, please. So the next one shows that not here, we are basically comparing household debt to also total net wealth, which is supposed to show that how leveraged basically households are. And we see that the first age group, the ones that are between 50 and 64, we see that their leverage ratio basically has increased sharply, both in average and median terms between 1992 and 2016. And we see a similar pattern for 65 to 74 age group. And similarly, we see not as drastic as the other two age group, but we see that changes for 75 plus as well, at least between 2010 and 2014, we see that their leverage ratios has increased. So the combination of all these information shows us that basically household debt has increased among the likelihood, and also amount of debt has increased among older Americans over the years, and also households are more leveraged. And we will show that in the research that this has implications on retirement and also Social Security claiming behavior of the elderly. We basically show that most likely staying in longer in the labor market and delaying claiming Social Security is one of the ways that older Americans choose to deal with increasing levels of debt, basically. So this also concludes this research. If we can go to the next slide, I believe. Okay. So here, I just wanted to show some of the upcoming research in the retirement side here in the EBRI. Just to highlight a few, please stay tuned for the upcoming research on the effects of COVID-19, and also the CARES Act on retirement income adequacy. Also, we're going to have researchers done on workplace wellness survey, and also financial well-being employer survey. So these are just, I'm just highlighting a few. These are, stay tuned for the future research coming up from the retirement side of the EBRI. And I think I was successful.
Yeah, in fact, you're early. Zara, thank you so much because that was an amazing journey through three important research topics, but also letting us know what to expect in the future, which is a lot of in-depth analysis that's going to be useful to EBRI members and everyone else. Thank you.
Thank you.
So we should move on to the health side of the equation, and Jake Spiegel is going to take us through 5 topics plus future research, and I'm equally fascinated by this group. And so, without further ado, Jake, why don't you take us through it?
Thanks for the introduction there, Brett. I'm going to try to give the healthcare side of things the same treatment that Sarah gave for the retirement side of things. So on the next slide here, I'm going to jump right in. The first paper that we're going to take a look at is the cost differences for oncology medicines paper. In this study, we used a commercial database of claims from employer-sponsored plans. Previous research has shown that insurers tended to pay more for cancer drugs when they're administered at hospital outpatient facilities rather than at physicians' offices. However, it wasn't entirely clear whether those cost differences were attributable because of different treatment regimens or because of different patient characteristics. Perhaps patients in hospital outpatient departments are systematically different from those who seek care in physicians' offices. And some drugs are administered more intensely for different patients, depending on the cancer type, depending on the severity of the cancer, depending on the patient's tolerance for the treatments. So we used a novel method to account for all of that and disaggregate the cost differences independent of the patient characteristics and the compositions of the drugs themselves. And what we found was that each drug was more expensive when administered at a hospital outpatient department. And they ranged from being about 28% more expensive to 328% more expensive. Notably, the average insurer reimbursement for oncology drugs was about $13,000 at physicians' offices and about $22,000 at hospitals. It's about an $8,753 difference between the two. If hospital outpatient department prices matched physicians' office prices, then insurers would have saved about $9,800 per user of oncology medicines, which would have represented a savings of about 45%. Now, there are some important lessons here for both employers and insurers. Employers can negotiate site-neutral contracts, and also insurers can use value-based insurance designs in order to nudge patients to seek out lower-cost providers. Next slide here. This next paper, we looked at HSA investors, who invests and who doesn't, and what factors might be associated with the decision to invest. And for this study, we used data from EBRI's own HSA database. Previously, we have found that only about 6% of HSA account owners actually invest their accounts. And we wondered what things we could learn about the account holders who transitioned to investing, the ones who didn't start out as investors, but then eventually transitioned to investing. What we found was that most HSA owners who invest their HSAs do so right away. About 63% dive right in. These are the people who are perhaps very engaged with their finances. They view HSAs as long-term savings vehicles. But 37% of HSA owners who invest didn't do so right away. Most of them decide to start investing within the first 2 or 3 years. We see 13% invested by the second year, 10% invested by the third year. But there are still some stragglers who invest in the 4th, 5th, 6th, 7th, 8th year and beyond. So what we wanted to do is we wanted to find out if there were any impediments to them investing and what things in common people who transitioned to investing had. And what we found were that longer account tenures and larger account balances are associated with an increase in the probability that we observe an HSA owner transitioning to investing. There also isn't much evidence to suggest that account owners wait to accumulate a specific balance. That we didn't see a lot of evidence that people were, waiting to hit a mental threshold of $1,000, $2,000, $3,000 before investing. And similarly, we also didn't see much evidence that high deductibles were an impediment to the decision to invest. So this paper has some pretty important takeaways for both employers and HSA providers. First, because account tenure is an important determinant in transitioning to investing, this suggests something of a familiarity effect. Targeted educational efforts might help employees see the value in using HSAs as a longer-term savings vehicle. And also because account balance is intrinsically linked with a higher likelihood in transitioning to investing, employers might want to provide some initial seed money to employees to help them use their HSAs as longer-term savings vehicles. Next slide, please. This next paper, we're going to take a look at the saving needs for Medicare beneficiaries. This study used a combination of publicly available survey data and also used a simulation model to generate these estimates. Savings targets for Medicare beneficiaries fell from 2019 to 2020 by between 8 and 10%. And this study looked at predicted expenses like premiums, deductibles, out-of-pocket expenses. And primarily the savings targets fell because Medicare trustees lowered their projected costs for Part D premiums and also out-of-pocket expenditures. And there's also a methodological change that occurred for this paper as well. Part of the decline is that the model assumes enrollment in Medigap Plan G. Previously, it assumed Medicare Plan or Medigap Plan F, but Medigap Plan F is no longer available to new enrollees. So what we ended up finding was that for a 90% chance of a married couple in retirement having enough money, for 90% chance of that married couple having enough money to cover healthcare expenses in retirement, for a couple that had 90th percentile drug expenses, they would need to have saved $325,000, which is a pretty big chunk of change. Even a couple with drug expenses at the median, the 50th percentile, they would still need to have saved about $270,000 in order to have a 90% chance of having enough money to cover their healthcare expenses. This study serves as a pretty good reminder of the challenges posed by high healthcare costs in retirement, and also the challenges of spotty retirement income security. Also, these issues might become more pronounced in the future as policymakers might take actions to address Medicare's solvency in ways that shift more of the responsibility onto Medicare beneficiaries themselves. So in reality, this $325,000 estimate might actually prove to be something of a lower bound, especially if future Medicare solvency changes shift more of the responsibility onto Medicare beneficiaries themselves. And also these calculations don't include the cost of long-term care, which might be substantial for some retirees. Next slide, please. So this next paper took a look at the composition of people who choose to enroll in COBRA. For this study, we used a commercial database of claims from employer-sponsored plans. And it's important to point out here, I'd like to just take a minute to highlight the fact that previous research into this issue has used survey data, which might introduce some biases. But this study is sort of first of its kind in that it's using actual administrative claims data to get at these issues. So for those who aren't aware, COBRA is an arrangement that allows recently separated workers to continue participating in employer-sponsored health insurance plans. COBRA benefits can be pretty expensive. When somebody enrolls in COBRA, they pay both their share of the health insurance premiums and also the employer's share, the part that the employer used to cover. So benefits can be pretty expensive. And also enrollees have 60 days to decide whether or not to take up COBRA benefits. So there exists a significant potential for an adverse selection mechanism where only those who anticipate high medical costs will enroll in COBRA, or because they have 60 days to decide, maybe those who actually already have incurred high medical costs will enroll in COBRA. And our study, unsurprisingly, finds that COBRA beneficiaries spent significantly more than those with coverage through a full-time employee, so those who are currently working. So we found a pretty strong evidence of that adverse selection mechanism. In particular, we find that for those with individual coverage, people who are enrolled in COBRA spent an average of $18,752 in gross spending in healthcare services, compared to only $6,724 for those who have coverage through a full-time worker. And similar discrepancies, though not quite as large, exist for those in family plans. One thing that was kind of notable about this study was that the ratio, we looked at 6 years of data in this, and the ratio of spending by COBRA enrollees to the ratio to spending by people with full-time employee coverage has actually decreased over time, which we took as evidence that the individual exchanges from the Affordable Care Act have actually partially mitigated some of the adverse selection at play here. Previously, when somebody lost their job, the only way for them to continue their healthcare benefits was to enroll in COBRA, but now laid off workers, separated workers have the option to gain insurance coverage through individual marketplaces. And these findings have some pretty significant implications for both policymakers and employers alike. Since on average, people who receive coverage through COBRA are systematically higher spenders, extending subsidies for newly separated workers to enroll in COBRA could be beneficial to the extent that policymakers and employers have a policy goal to improve the risk pool for COBRA claimants. Systematically higher spenders might be balanced out by marginally healthier workers who are enticed to enroll in COBRA because of subsidies. And also, again, it's important to point out that the ratio of spending by COBRA enrollees to full-time employed enrollees has decreased over time. So this adverse selection mechanism has already sort of mellowed out a little bit. Next slide, please. This next paper, we looked at HSA contributions and the interaction with state taxes. We used data from EBRI's HSA database for this study. And we wanted to look at the extent to which state tax laws were correlated with contributions to HSAs. Some states don't levy a state income tax, and some states don't offer a tax break for contributions to HSAs. And the impact of that is that the value of a marginal dollar of HSA contributions is higher in a state with state income taxes. And the value of a marginal HSA contribution is lower where there's no tax break at all, or that state doesn't offer or doesn't levy a state income tax to begin with. And what we found was that on average, contributions tended to be lower in states with no income tax or without that state tax break on contributions. In particular, the average contribution in states that followed the federal tax treatment for HSAs was about $1,620, whereas the average individual contribution in states that don't have a state income tax or that state tax break, the average contribution was $1,552. So a difference of about $70, which is not a huge amount, but illustrates that there is a, HSA owners are responding to incentives. But also there was just a whole lot of across the board variation in trends among states. California, South Dakota, Washington, Wyoming had slightly higher than average contributions. Alaska, Florida, Nevada, New Hampshire, New Jersey, Texas, Tennessee, all states without state income taxes had below average contributions. But also importantly, some states that do offer a tax benefit for HSA contributions actually had some of the lowest average contributions, such as Kentucky, Maryland, Virginia, and Mississippi. And also, we have a little bit of extra time here, so I'd like to highlight that this paper was the backbone of the very first EBRI interactive visualization. This is a series of visualizations that we're working on. This is sort of a new capability that we have pushed out and been working on, and keep an eye out for more visualizations in the future. But we actually have a link to this, so we have just a little bit of time that we can play around with this and show you the capabilities of this. So we click on the link right here. This opens up our interactive visualization. And so on this map here, what we can see is states that are bluer, that more intense blue, are states that have higher than average contributions, and states that are washed out or have that sort of a white color. Those are states that have below average contributions. And so what we can do is we can hover over each individual state to see how far above and below the national average they were. And if we wanted to see if there are any, for example, any geographic similarities between states with systematically higher contributions, what we can do is we can click on that dark blue bar down at the bottom there to see states that have, it highlights the states that have that particular characteristic.
Hey, Jake, can you do
Yes.
Indiana?
Yeah, let's take a look at Indiana. There we go. I think we need to turn the, yeah, there we go.
Yeah, there you go.
Perfect. Okay, so let's take a look at Indiana here. Indiana actually has slightly higher than above average contributions. So for those Hoosiers out there in the audience, congratulations. Your hometown has done you proud. So yeah, this is going to be a recurring feature. So please be on the lookout for future installments. We're pretty excited about sharing this new capability that we've been developing with you all. So we can pivot back to the presentation now. And I'm just going to quickly highlight on the next slide some of the in-progress research that we have. I'd like to first highlight a Medicare buy-in analysis project that we're working on. We're going to look at how many workers might switch from an employer-based health plan to Medicare if they were given the option. And we're also going to look at how that might affect employers. We're going to take a look at who switches. Will it only be systematically lower spenders, or will it be systematically higher spenders? Systematically higher spenders might want to switch because Medicare features lower reimbursement rates than private insurance does, so they might pay less for their treatments. But also they might want to switch, they might want to stay with their own employer-sponsored plans because Medicare doesn't have an out-of-pocket maximum. So we might end up seeing a situation in which only lower spenders end up switching. So we're going to be using a simulation model to try to do some rough back of the envelope calculations to see what the effects, who might switch, why, and what the effects on employers are. I'd also like to highlight the workplace wellness survey. We've revamped some survey instruments to make it more consistent with some of the other surveys that we put out, which helps identify trends. And then also we added some instruments to gauge the impact of the COVID-19 pandemic. And also the same story with the consumer engagement and healthcare survey. We added some new instruments to add to better gauge telemedicine usage, workplace wellness offerings, and also how the COVID-19 pandemic affects workers and how they consume healthcare, how they choose, how they make their decisions. We've also been conducting some interviews with health benefits executives on the future of health benefits in the workplace. We've done about a dozen interviews so far. We have about another dozen more on the docket. And this was a topic that was actually, we discussed during our recent policy forum. We presented some preliminary findings. Namely, what we're trying to get at is under what circumstances might employers choose to stop offering health benefits? Since this is the first recession, since the individual ACA exchanges were implemented, many employers see health benefits as a useful retention tool, but they're also wary of ever-increasing costs. They're not always confident in their ability to contain them. So one could make the argument that this might be a good time for employers to get out of the health insurance game altogether. And we're in the process of evaluating the extent to which employers might change their offerings in the future, and in particular, how they're responding to the COVID-19 pandemic as well. We're focusing on mid-sized and large employers because they're often trendsetters. And if you or someone you know are interested in participating, I would encourage you to get in touch with either me or Paul Fronston. We're also looking at a study on co-payments versus co-insurance when it comes to utilization. Are workers more sensitive to co-insurance or co-payments? And finally, I'd like to plug one more thing that's actually not on this slide. We're currently in the beginning stages of scoping up the feasibility of conducting a study on telemedicine. So if you are interested in partnering with us on this, if you or someone you know has access to telemedicine administrative data, please get in touch with me or Paul Fronston because we are very interested, and we're hearing a lot from members that telemedicine is something that they're very interested in, and we'd like to get into, we'd like to evaluate, do an evaluation. So that about covers it from the healthcare side of things. I know we have a couple more slides here at the end. I think I'm going to kick it back over to you now, Brett. Is that right?
Absolutely. Right. Now we're doing Q&A, but since you mentioned the new studies and potential for collaboration and contribution, I want to just emphasize that it's both in healthcare and in the retirement area. The research centers within EBRI have been doing this wonderful work, a lot of which you've heard about today. And they're definitely looking for additional partners to get some of the work done that they've got planned in the future. And you can see this is amazing social science methods applied to really important questions in both retirement and healthcare. So let's go to questions. Let's one of the last ones that came in was well, I'm sorry. Let's do one that kind of covers both health and retirement. How does the level of confidence in retirement funds match up to the reality of savings levels and ever increasing medical costs? So that's kind of a Zara question, but also I think Jay could comment on this.
Yeah, I think, I mean, Craig, who's done the research and worked on this research, is the main person that can comment on this. So I would suggest that to get in contact with him. But again, I cannot comment on if the confidence matches the retirement funds and also the reality in medical costs. But I think that what was interesting to me is that the change, for example, the change in the conditions, in economic condition and also policies impacts the confidence. For example, just 2 months into the survey, the confidence about being able to cover medical expenses has been decreased for those for the retirees, just 2 months into the pandemic. So I would think that probably the anything that is related to medical costs that will change the expectation, people's expectation about future medical costs will impact their confidence. That's how I would think that, and it will have an impact. It will show that and to the impact, and hopefully in the future we will see that when we have the future waves of the survey, we will see the full impact of that. And also we are looking basically on these right now throughout the workplace wellness survey, and we would see the impact of if the increase in, you know, the being worried about the future medical expenses, and also the retirement plans, it will have impact on retirement confidence.
Yeah, thank you. I think this is a good question, because it's asking, I think that what I hear is it's asking both how is retirement confidence changing along with retirement reality, but also, is retirement confidence realistic? You know, is it too pessimistic? Is it overly pessimistic, depending on, you know, on what exactly the financial conditions are? And so it's an important question, I think.
Yes, I agree. Yes,
and
I agree. I mean, it's how one of them is a state of mind, the other one is that what happens in reality. And even if the extent of it might not match, I think that as long as they are in the same trend, it shows that we are in the right track. I feel like. And for me, the indicator, for example, is as I mentioned, is that like just a few months into the pandemic, people are worried about medical expenses, and that impacts their confidence about being able to cover medical expenditures. So I would only imagine that at least going into the research, I will have the assumption, I would like to assess this assumption, thinking that, yeah, I mean, if in reality, things change for the medical expenditures and also retirement, it should have an impact. On the confidence.
Thank you, Zara. There's actually another one that just came in that's on the same topic, or similar topic. So let's stick with that. James, Sam asked that first question. James asked the next one. What do you think caused retirees, their retirement confidence among retirees, to fall in 2020 versus 2019 so significantly, even prior to COVID-19? Because if I remember right, the very confident went down by 5 percentage points, for example.
Sorry, I was on mute. Yeah, so that's right. I think the retiree confidence was down in 2020 compared to 2019. Again, I'm not the researcher on this topic, and in more specific questions should go back to the researcher. But I would think that, for example, we saw in the next research that the condition of household debt is increasing over time. That's one of the things. So, okay, we also have Craig here. I mean, he's able to respond. I will.
Oh, good.
Okay, Craig.
One of the things that looked like it was causing it was the perception of the healthcare cost. That really seemed to be affecting people prior to the COVID-19 for retirees, not so much for workers, but for retirees. And that seemed to be kind of driving the lower confidence for retirees, but you still see the confidence of retirees is higher than that of workers overall, and that tends to be as people get older and their situation becomes clearer, they become more confident in being able to live the rest of their life comfortably.
Thank you, Craig.
So I have a healthcare question, and that is here, and that is, what is the distribution of out-of-pocket healthcare expenses among retirees? Now, there's of course I know there's two answers to that question. One is with in nursing homes, in nursing home care, and one without. But it's also the case that I wonder if the distribution of out-of-pocket healthcare expenses looks a little weird. It might not be a normal distribution. Jake, I don't know if you could talk to that.
Yeah, I would say it's I think economists and statisticians use a concept of a distribution with fat tails. I think that's probably the case with healthcare spending as well. One of the tasks that I had been working on for the Medicare buy-in model was actually coming up with a simulation model that approximated healthcare expenses that we observe in a commercial claims database. And I can tell you that there's some large outliers, and that's just among workers, people who are currently employed. For people who are in retirement who accumulate significant long-term care costs, that spending is even further along the distribution. That's many standard deviations away from the mean. But yes, given the fact that you have healthcare costs in retirement potentially costing a couple in retirement $325,000, and that's not even including long-term care costs. That's it can be a pretty significant outlay.
Right, and that's what I was getting at, is that, yeah, we can call it weird, we can call it fat tails, but what I think it boils down to is that if you take a normal distribution, what's going to happen in healthcare is it's going to be some subset, I don't know, how big the number is going to have very high health expenses, and then some people are going to have very low health expenses, and so there might be fat tails on both sides.
Exactly. Yeah, you just nailed it.
Okay. Yeah, I just thought that, to me, that's interesting, and in the healthcare area. Okay. And speaking of geeky questions, so here's another one, but it goes back to retirement. You're in the right crowd
here.
It goes back to the retirement part. Zara, you were talking about retirement deficits, right? And I kind of know from the EBRI model, there's a difference between deficit, surplus, and net. Now, when you were talking, are you talking about the net deficit, or are you talking about among those who have a deficit, what's the deficit? I know that's really geeky, but it's the part of the model, so I just wanted to clarify that.
As far as I remember, it was the retirement shortfall. It wasn't the net.
It wasn't the net. So among people who are going to have a shortfall, how much bigger is that shortfall going to be? So that's actually an important thing to know, because there's three different things that EBRI looks at here. I mean, there's many things, but three of the things that they look at are of people who are of the population that's projected to have a shortfall. How big is that shortfall, and how might it change? For people who are projected to have a surplus, how big is that surplus, and how might that change? And then EBRI takes the two, puts them together, and says, what's the net? Is the net a surplus, or is the net a deficit? And so what you seem to be saying is that of those who are projected to have a shortfall, how much bigger is that shortfall going to be because of coronavirus and various scenarios associated with that, right?
Yeah, I mean, as far as I remember, that was the shortfall.
Yeah, okay. Just a point of clarification, really geeky, but it's something that EBRI takes a look at in their model, and that's useful. So we're gonna stop here, but can I have the next slide here? Slide, please. So this is just a little look at EBRI research centers and surveys, right? So there are centers that function as kind of think tanks within the EBRI: the Retirement Security Research Center, Center for Research on Health Benefits Innovation, Financial Wellbeing Research Center, surveys, the Retirement Confidence Survey that you just heard about, and future plans for consumer engagement and workplace wellness surveys. we urge you to contact Betsy Jaffe about your participation in these surveys and centers if you're not participating now. Please do. And last slide, please. Again, upcoming EBRI programs, I mentioned that we're going to talk about those. July 22nd, Savings and Caregiving in the Age of COVID. July 28th, Retirement Confidence Survey findings. So, you know, a deeper dive is going to happen on July 28th. COBRA, a deeper dive on that is August 4th. The Winter Policy Forum is coming, but not for a while, not till December. But you can get information about all these on ebri.org. And the last thing, you know, again, contact Betsy Jaffe. We put in 2 ads here. The last thing I want to mention, though, is a thanks to Lori Lucas, the head of EBRI, for all the leadership that she is showing in this time, and for helping redirect the organization in response to coronavirus, and helping out all our members and everyone else in the policy community. So, and then the last thank you is to David Smith, who behind the scenes runs a huge number of things, including this particular webinar. Thank you, David. And with that, thank you all who joined us, and we will look forward to the next time with an EBRI webinar. Take care.
Thanks, Brett.
Thank you.